Assalamualaikum warahmatullahi wabarakatuh. Ya, good morning, my college, respect reviewers and fellow researchers. My name is Leila, and it's an honor to present our study entitled Physical Preconception Readiness Among Unmarried Adolescents, a Multivariate Analytical Approach. Yeah. Um, There author and their author it's me uh, Railanisha Ayanda, and second author is Petriani. We are from University Muhammadiyah Pekanbaru Bekayan. Yes. The preconception period is increasingly recognized as a critical phase in the reproductive health continuum. It represents a window of opportunity to establish optimal physical, psychological, and behavioral conditions prior to pregnancy. However, in many low-middle income countries, including Indonesia, preconception health services and awareness are often initiated only after marriage or during early pregnancy. This condition delay means missed opportunities for prevention, especially because many biological and behavioral risks begin long before conception. Adolescence, therefore, become an important strategic period. It is a life stage where individuals begin to develop health habits, reproductive maturity, nutritional patterns, and psychosocial identity. These factors collectively shape long-term reproductive and pregnancy outcomes. Despite this, unmarried adolescents are frequently excluded from formal preconception health intervention due to cultural sensitivity, stigma, or lack of policy prioritization. As a result, many enter marriage and pregnancy without adequate physical readiness, which may increase risk for maternal mortality, preterm birth, low birth weight, anemia, and other complications. This gap in policy and practice motivate our research. Okay. And then the primary aim of this study was to analyze the factor associated with physical preconception readiness among unmarried adolescents in Indonesia, and to identify the most dominant predictor influencing this readiness. We use a quantitative research design with a cross-sectional analytical approach. The population includes unmarried adolescents across 10 provinces in Indonesia during the year 2024, and then a total of 524 respondents were recruited through a cluster random sampling method. Data were collected using a structure and validate a questionnaire distributed via an online survey platform. And then ethical approval was granted to reference number 027 PEP UMPP 5 2024, ensuring for compliance with ethical principles of confidentiality, voluntariness, and informed consent. For statistical analysis, we conduct univariate, bivariate, and multivariate modeling. T-square, first T-square testing was used to examine bivariate association, and multiple logistic regression was applied to identify the dominant influencing factor. Okay. The research result, our analysis revealed three variables significant associated with physical preconception readiness. First, body mass index or BMI, with p-value 0.007 and odds ratio 1.825. There is a significant relationship between BMI with physical readiness during the preconception period. Second, reproductive health status. With p-value 0.000 and ratio 3.553. There is a significant relationship between reproductive health status with physical readiness during the preconception period. And then third, mental readiness with p-value 0.000 and odds ratio 2.278. There is a significant relationship between mental readiness with physical readiness during the preconception period. And then this finding demonstrates that physical readiness is multifactorial, involving biological, behavioral, and a psychosocial dimension. Among this variable, BMI emerged as the strongest and most dominant predictor with exponent value of 1.342 and 95% confidence interval of 1.342 until 3.107. Okay, this result means that adolescents with a balance of normal BMI were significantly more likely to be physically ready for the preconception period compared with adolescents who were underweight or overweight. The significance of BMI relates to several biological mechanisms, including first, hormonal regulation, second, ovulatory stability, third, adequate micronutrient source, fourth, a balanced body composition, fifth, reduced risk of metabolic and obstetric complications. These findings strongly reinforce the importance of nutritional awareness and healthy weight maintenance during adolescence, not only to support general well-being, but also to prepare to serve future pregnancy outcomes. And then, this study highlights the urgent need for proactive and comprehensive preconception health strategies target specifically at adolescents before marriage and before pregnancy planning occurs. Key components should include first, strengthening preconception health literacy. Second, implementing routine reproductive health screening. Third, providing psychological support and mental readiness program. And fourth, integrating nutrition-focused intervention, including BMI monitoring, dietary education, and healthy lifestyle promotion. Such program could be integrated into school-based health services, youth community platform, digital health site system, and or national reproductive health policy and framework. Okay. The conclusion is physical preconception readiness is a crucial determinant of future maternal or neonatal outcome. Our findings demonstrate that body mass index, reproductive health status, and mental readiness significantly influence physical readiness among unmarried adolescents in Indonesia, with BMI identified as the strongest predictor. Improving adolescent preconception preparedness represent a strategic investment in long-term reproductive health and maternal child well-being. Thank you very much for your attention. I welcome by question, feedback, or discussion. Thank you.